Over 4 billion rand. That is how far short our health budget is compared with last year. While part of that decrease is due to COVID-specific costs not being required anymore, there has in fact been no upward adjustment for the sharp increases in inflation over the last year. And when you factor that in, the health budget is actually at least 11 billion rand short. This, of course, at a time when infrastructure is falling apart, rolling power cuts are adding massive costs to the bottom line of many hospitals, and staff are urgently required. On Tuesday, the Health Minister, Phaahla, tabled the health budget for 2023-24, and I'm joined now by the Deputy Health Minister, Sibongiseni Dhlomo. Dr. Dhlomo, thank you so much for your time. The Health Minister himself explained that it is, in fact, in real terms, 11 billion rand less than the previous year. Such a critical area of care in our country, so many clear problems. What does this actually mean on the ground in our hospitals and clinics?
Good evening, Sally, and good evening to all your viewers. Indeed, hence, among other things we had last week was the Presidential Health Summit, the second Presidential Health Summit. And we know and we realize how supportive our president is to this program of health, because you now know we come from COVID. If you undermine programs of health, you are likely to pay much longer and much more deeply in the other processes, as COVID has shown us. So we are not really promising that since we have had a meeting, the Presidential Health Summit, things might improve. But this is all about the fiscal restraint and the constraint we have in the country, where we have to make do with little. We then have to sit back as a department, as provinces, to say, how do we manage? Because you are correct, Sally. Among the things that have been expected of us is to improve the infrastructure, to hire more of the healthcare professionals, and to expand the services even in the far-flung rural areas, get doctors, get the machines. So it's something that our minister will have to sit down with all of us and say, what do we prioritize here in this space? While I'm aware that the minister, with the support of other cabinet ministers, will be writing to the finance minister to say, look, we will not be able to manage 1, 2, 3, 4. Over and above, Sally, you know, I can tell you this much without fear of contradicting myself. The hospitals in the provinces like Limpopo, Mpumalanga, and Gauteng, at this current moment, if there are 30 women who are in labor in Chris Hani Baragwanath Hospital, half of them are not South Africans. Now, and you know that the allocation, little as it may be, sent to Gauteng was equivalent to the head count of that province. Now, if we have got additional other citizens of the world into our space, then the issue is even much more. It's worse than what you and me are talking about. But that's a separate discussion, Sally, that through diplomatic discussions within SADC, within Africa, must be held up. And I know there is a very strong commitment from DERCO and from our minister to continue with those actions.
We also saw recently in Gauteng there was a court ruling that said this directive issued by the Department of Health in the province that meant a lot of foreign women and little ones were being turned away from government hospitals was actually illegal. And they now have to allow those women and children in. It is, in terms of our constitution, it is the right thing to do. Clearly, if you say that there are that many foreigners who are relying on South African healthcare, it does add to an already overburdened system. But the reality is we do have to accommodate them as the law stands right now. The bigger issues, I think, are around the fact of years of neglect around infrastructure. We look at Rahima Musa Hospital, for example. It used to be a beacon of amazing maternity and young child care. Today, it's literally falling apart. Chris Hani Baragwanath can't get its food supplies sorted out. It doesn't seem to be well run. It should be like a well-oiled machine, the biggest hospital in Africa. To what extent do you have to point at the people who run health, the politicians, the DGs, the hospital administrators, and say, actually, they're just not fit for purpose? They have been doing a bad job for a long time, and this is the fruit that we are now reaping.
That statement, Sally, may not be accurate generally speaking, because there are pockets of excellency in the country. You must take away issues like Tembisa Hospital. Within the whole sector of Gauteng hospitals, some of the hospitals are doing fairly well. For instance, Baragwanath has got 9,000 workers at any given moment. Now, that's a huge number of citizens. So you probably need to have a bigger and a beefed up management of that sector. But it's probably not actually correct even on infrastructure. There has been an acceleration of expansion of clinics. I can vouch for you. I was an MEC for health in KwaZulu-Natal for 10 years. We accelerated quite a lot of other hospitals. We built a state-of-the-art hospital called Fiscal. So yes, there are challenges in other parts of our provinces, but there has been acceleration and improvement in other areas. So it may not be a correct statement to say generally all our managers, all our CEOs in all our hospitals are just not doing a right job. It's just that when they are, like Rahima Musa, we pick up. Hence, that is why independently, you say, Professor Makgoba, independently as an ombudsperson, listen to South Africans who are criticizing and are challenging us about certain things they pick up in hospitals, attend to them, advise us how to move on. The same thing like Esidimeni Hospital comes in because somebody just missed the boat there. And Rahima Musa and other areas where we are saying things have not gone right here. But Sally, there are areas excellently that are doing well in the country. You probably don't hear much about that, because if something is not wrong, none of it goes into the news.
Yeah, the reality is that some of these incidents around Esidimeni, Chris Hani Baragwanath, Rahima Musa and Tembisa, they have cost lives and they are extremely serious. I'm not saying that's the entire picture, but I'm saying it's a fair part of the picture. But I have to ask you a question about the impact of load shedding. We know that the health department has been making great efforts to make sure that clinics and hospitals are in fact excluded from load shedding. Last Friday, the court said actually clinics and hospitals have 60 days along with police stations and schools to actually make a plan. Update me first on how many hospitals you've been able to exclude from load shedding. I know it's a tricky process. And then talk to me about this coming fiscal, because if we're going to stay in stage 6 and beyond, that is going to put enormous pressure on our hospitals. We know that public works comes to the party to some extent, but it's going to surely blow your already decreased budget. Am I right?
Quite correct, Sally. We actually had applied to have 216 hospitals countrywide to be exempted from load shedding. We have quite a lot of other facilities. We probably would go without exempting that clinic and that other hospital in some, maybe many clinics that probably are 12 hours then actually, so that we are not being seen to be unreasonable. But so far we have successfully been exempted of the 76 hospitals. One of the other challenges, Sal, is that that hospital is fully embedded within the community. Therefore, if you have to have a separate line for, like example, Prince Msheni Hospital in Umlazi, now you must then have infrastructural configuration to separate the line from that. And number two, other clinics, they have to actually work on with municipalities to get into that space. So it's a work in progress. We wish you could do better than the 76. But yes, most of our 24-hour service facilities, health facilities, have got generators. But yes, Sally, those generators were meant for a 2-hour, 3-hour, 4-hour session. If it goes beyond 3 hours, then our generations give up. They are not able to deal with that part. But secondly, the generator is meant to support you for ICU, high care, and very critical areas. It's not meant to really boil water for your whole hospital and really provide cooking generation for the hospital. So we will have to have those challenges. Hence, we were actually asking for expanding the exemption of the facilities that we are dealing with in health.
And very quickly, you mentioned this earlier, you did suggest that the Health Minister is going to be challenging this reduced budget in some way. Just talk us through that very briefly.
Not necessarily challenging it, Sally, but just to explain, to say, look, these are the challenges that we face. If we do not really work around this and improve the budget, we will have 1 or 2 nurses short in that facility, and that on its own will therefore expose us to certain malpractice, professional misconduct, and litigation. So if you don't pay today and try and get money today to employ a bit more staff than you have, you probably pay next year or the other year with the medical claims that are going to come in there. So it's that type of a situation where most people must support that view to say, whichever way you pay, you probably you forego getting 3 or 5 nurses and therefore pay a huge amount when it comes to medical legal litigation. So where do you come in here? Can you not maybe try your best to raise more funding to improve your staffing so that at least we can have an optimal care of the staff and really reduce the exposure of risk of getting into such issues.
Doctor, thank you so much. You make such a good point. Short-term budget cuts can very quickly lead to long-term health problems. Deputy Health Minister Dr. Sibongiseni Dhlomo there. It's time now.